Chapter 5. First Aid. An accident always occurs accidentally. Accidents can happen anytime without a warning. They can occur on the road, in the house, in the school, on the playground, and even in your own room. We must follow certain safety guidelines to avoid accidents. But in case an accident does occur, we must be alert and conscious to help ourselves and also other people around us who might have been affected by the disaster. Sometimes there is a sudden accident or illness and no doctor or nurse may be nearby to help. The person may be hurt or bleeding, or he may have fainted. In such a case, the first step is to give help to the injured person until a doctor or an elder comes, or until the patient can be taken to the hospital. Training in the first aid is very useful and important, as many lives can be saved by giving proper emergency care before the doctor arrives or the patient reaches the hospital. Basic principles of first aid. Examine the victim carefully and determine what immediate help is needed by him. Call a doctor immediately. Try to keep the injured person and other people calm. Protect the victim from further injury and instill confidence in him. Then give him first aid. First aid box. A first aid box contains all the things required for immediate help to the injured victim. These include a bandage, cotton, wool gauge, a pair of scissors, blade, potassium permanganate, lal dava, antiseptic solution, spirit, thermometer, etc. These things can be used in case of an accident. A person who has to give first aid must keep the following points in mind. He/she must have full knowledge of the materials available in the first aid box. He/she should also know how to handle the materials in the box. He/she should not panic on seeing the victim. There are many occasions when we need to provide first aid. Let us know about some of these situations. Wounds and bleedings. Treatment of minor wounds such as cuts and scratches do not require a doctor. If you follow some simple rules, first of all, clean your hands with soap and water. Then clean the wound with a solution of an antiseptic such as Dettol or Savlon in water. Take care to remove every bit of dirt in the wound. If it is not done properly, the wound may get infected. Apply an antiseptic cream over the wound. Now put a thick pad of sterile gauze over the wound and press it with your thumb and finger. Protect it with a bandage or medicated self-adhesive tape. If the bleeding from the wound does not stop, use a tourniquet. A tourniquet is a light band that is tied above a wound to control heavy bleeding. If the wound is deep, the patient should be taken to a doctor after cleaning the wound. He may require an injection to prevent a dangerous disease called tetanus. Taxone. An ATS, anti-tetanus serum injection, is required to be given in case the cut is made by a dirty or rusty object. Electric shock. In case someone gets an electric shock, first of all, put off the main switch to cut off the power supply. Make the victim lie down. Make him calm if he is in trauma because of an electric shock. Do not give any liquid diet to the victim. If he does not recover, immediately call for a doctor. Heart attack. One of the leading causes of the people's death is heart attack. It begins with a severe pain across the chest. This pain sometimes spread to the neck, arms, and stomach. It usually lasts for 5–6 minutes. The victim may find it difficult to breathe. Sometimes he may feel like vomiting. Do not allow the victim to move and call a doctor at once. Burns. Sometimes boiling water or hot oil falls on a part of our body accidentally. Many times we touch a hot object by mistake. Such incidents burn our skin. The intensity of the burn depends on the level of heat of the object, the kind of clothes we are wearing or the kind of weather, etc. In case of minor burns, pour cold water on it for a few minutes and then apply ointment like Burnol. Do not apply ghee, oil, etc. on the burnt part. You can keep an ice or cold water pack on the burnt part. Do not cover the burnt part with thick cloths. If a person's clothes catch fire, make the person roll on the floor. Do not wrap a blanket around a person whose clothes have caught fire. Protect the burn from dust, dirt, flies, etc. Cover it with a thin and light cotton cloth. Do not tie the cloth tightly. Do not use dirty cloths. If the burn is severe, go to a doctor. Do not go to an unqualified person. Sometimes blisters are formed due to burns. Never prick them, otherwise they will result in wounds which get infection soon. Chemical burns. Some burns are caused by chemicals such as acids. In such a case, remove any clothing from the affected part. Use plenty of water to wash off the chemical. It reduces the extent of injury. Then clean that portion of the body with a soft towel gently and follow the first aid as given in the case of other burns. In case of severe burns, take the patient to the doctor. Poisoning. We use many things at our home like nail polishes, medicines, paints, etc. These things are poisonous. All such things should be stored away from the reach of children. If a child happens to take any of these poisonous things, try to induce vomiting in him. Give him warm, salty water to drink. This will induce vomiting and the poison will come out with the vomit. For further treatment, take the victim to the doctor. Snake bite. Snake bite needs immediate first aid because the poison of snake moves very fast through the blood and affects the heart and nervous system, causing death. Apply a tourniquet just about the bite to reduce the flow of blood to the heart. Rush the victim to a doctor as fast as possible. Eye injuries. There are many causes of eye injuries. They include insect bites, excessive exposure to the sun, harsh chemicals, a grain of sand, etc. All eye injuries should be taken seriously. In such a case, do not rub the eyes. If some foreign object is under the upper lid, look down and pull the upper lid away from the eyeball, then try to touch the object with the tip of a moistened piece of cloth. Fact zone. Diarrhea or vomiting leads to loss of body fluids. This condition is termed as dehydration. Oral rehydration solution (OS) should be given to the patient. Diarrhea generally we are not aware of our food. We may eat contaminated food from a hawker. Similarly, we may drink water which is not clean. This leads to a disease known as diarrhea caused by contaminated food and water. If somebody gets this disease, he will not be able to digest anything. He will have loose motions and vomiting. All this causes excessive loss of water in the body. In such a case, the patient should be given only liquids like ORS, oral dehydration solution, or Electra. To drink, this solution makes up the loss of water from the body. Sprain. Sometimes when we run very fast or when our foot twists, it can cause a sprain. It happens because of a tear in the muscles. The affected area can be very painful. There can be swelling also. In such a case, give sufficient support to the affected area, especially hands and legs. Do not massage it, but put a cold water pack on the affected area. After 24 hours of the sprain, put some salt in lukewarm water and give fermentation. Continue the support to the affected area, especially hands and legs. Wrap an elastic bandage around the joint to keep it still. The sprained joint should not be moved before it is healed. Drowning. In case a person gets drowned, he or she should be pulled out of the water. Make him lie upside down so that his stomach rests on the ground. Push his back forcefully to remove the excess water which has entered his belly. If the victim remains unconscious, give him artificial by blowing air from your mouth into the victim's mouth. If the victim does not recover, rush him immediately to the doctor. Faint or unconsciousness. Sometimes a person becomes unconscious or gets faint due to any reason. If it happens, first of all, loosen the clothes of the victim. Take him to fresh air or open the windows and the door of the room. Sprinkle some water on his face. If he does not come back to consciousness, call for a doctor. Nose bleeding. A nose bleeds when the walls of the blood vessels in the upper nasal passage get ruptured. This is a very common problem with the children. In such a case, make the victim sit in an upright position with head held back. The patient should breathe through the mouth. Hold the nose between thumb and finger for some time. Apply a wet cloth or ice on the nose and the forehead. This will stop bleeding. Little amount of bleeding from the nose is not serious, but if the bleeding still continues, take the victim to the doctor immediately. Insect bite. Insects like a bee, a wasp, etc. are commonly found around us. These insects sometimes sting us, which can be very painful. Sometimes a sting can cause swelling in that part of the body. In such a case, place a piece of ice or pour cold water on the affected part. You can also apply ammonia or lime water on the affected part. Heat stroke. During the months of May and June, it is very hot in some western and northern parts of our country. We experience very hot and strong winds called Lu in those days. Due to the heat, the temperature outside is also very high. If we remain out in the sun for a long period, we feel giddy, tired, and get a headache. These are the symptoms of a heat stroke. In such a case, make the patient lie down in a shady place. Do not crowd around him/her. In case of high fever, a cold sponge is helpful. Do not cover the patient with any cloth, especially woolen cloth. Give the patient a solution of salt, sugar, and lime, mango. Do not give hot tea or coffee to the patient. Animal bite. In case of animal bite, wash the wound with soap and water to remove germs, as the virus causing rabies is carried in the saliva of an infected animal. Dogs, wolves, bats, and cats are known to carry the rabies virus. Apply an antiseptic to prevent infection. Cover wound with a bandage. Then take the patient to the doctor immediately. If the animal is found to have rabies, the doctor will give him a course of injections. Concept map. First aid, poisoning, snake bite, eye injuries, diarrhea, insect bite, sprain, drowning, faint or unconsciousness, nose bleeding, heart stroke, animal bite. Basic principles of first aid box. Wounds and bleedings, electric, shock, heart attack, burns, chemical, burns,